My name is Lexus C, and I'm a virtual nurse at Banyan Medical Systems. My role here, primarily what I do is I help augment the bedside nurses' workflow. So I help with admissions, discharges, patient education. We also do rounding and just do checks on the patients to see if they have any questions, any concerns, and if there's anything that we can kind of help make more clear for them. A typical day, we come in and we pretty much start with chart checks, and we're essentially reviewing all of the patient charts to identify any gaps missing, to find any sort of tasks that need to be completed. After that, we start to complete those tasks. We do admissions, so we talk to and interview the patients. We ask them about their medical history, what medications they're taking. We also help with discharge instructions, so we'll go over their diagnosis, any specific meds or directions that they need to follow once they do get discharged from the hospital. We also just do the hourly rounding, so we just talk to the patients. We genuinely care about how they're feeling, what they need, and sometimes the bedside nurses don't have time to address or talk to them about all those needs, so we can kind of bridge that gap so they feel heard and cared for. The culture here is really good. We have a lot of teamwork. So if you need any help, even if we're just not on breaks or lunches and things like that, you can put in a chat at any point that you just need assistance, and you have everybody jumping in to help with admissions and discharges. But we typically just communicate amongst each other within the healthcare system and just say, hey, I'm going to lunch, I'm taking care of Ocala cardiology. And then the other team members that are part of the healthcare system know to watch for that unit, and they help with admissions and discharges and whatever task needs to be completed while that virtual nurse is away. There's like complimentary meals in the break room. So we have like frozen meals and things like that. There's always like snacks like Nutri-Grain bars and popcorn, healthy choices, flavored water, sweet tea, like that kind of stuff. So they really do make sure we have what we need to keep going and to refuel ourselves so we can give back to the patients. I had an incident, well, not really an incident, but I helped a patient and also a provider. So I had a patient who had a lot of laboratory studies done. They were very unclear on what the studies were, what the results meant, and those kind of things. While I was rounding on the patient and talking to them, the provider came in. They began to ask the provider about the test, and the provider was unable to pull up that information to kind of elaborate more with them. One of the things that we can do while we're rounding and things like that is we can actually share our screens with the patient on their TV. So I was actually able to go into the patient's chart while the provider was in the room, pull up the laboratory studies and the imaging, and the provider was able to look at it on the TV and actually in real time review the imaging with the patient, give them some clarity on their diagnosis, and kind of bridge the gap in just education and knowledge so they knew what to do and how to care for themselves when they got discharged home. My favorite part of my role is I get to do something that I feel like is going to augment how healthcare is just run entirely. There's not any technology like this, and there's no other companies that are doing what we do at the caliber that we do it. It's also just gonna make things easier for the bedside nurse. The other thing I like about it is, as a bedside nurse, I did not have time to connect with patients and answer questions and have long-winded conversations. You're very task-oriented. You have to prioritize a lot of things, and it's a tough hat to wear. And unfortunately, you have to cut some things short, and the patients don't always get their emotional or educational needs met as they may have if we had smaller patient assignments and things like that. So as a virtual nurse, I am able to spend more time with the patient. So if they have any questions, I'm able to talk to them. I've even had instances where I've called into rooms just to do safety checks, and the patients are just emotionally distraught, whether it be about their diagnoses, maybe family concerns and things like that. And I'm able to allow them that space to vent so they can have that comfort, know somebody is listening to them, offer them therapeutic solutions so they can improve their situation.